Smile is sponsored by Greer and Maggard Orthodontics.
Today we're busting some of the biggest myths about braces and clear aligners, separating fact from fiction so you can make informed decisions about your smile. Joining us is Dr. Lauren Delpont with Greer and Maggard Orthodontics to answer some of the most common questions families have about orthodontic treatment. So welcome to the show.
Hello.
Hi, thank you for having me.
Of course. So we want to bust some myths here. And is it true that braces are only for kids and teens?
No, many adults are great candidates for orthodontic treatment. So as long as your teeth are healthy and the supporting structures, meaning the bones and the gums, we treat lots of adults. So the majority of our patients probably are teens and children, but a growing number of adults are seeking care.
Yeah, and I've known some adults to do it, and it's changed their life. They're glad they did it because it just takes some time, and then you're done, and then you got perfect teeth again.
Yeah.
So how long is the process generally? Has it gotten shorter over the years with new technology?
It absolutely has. So we use 3D printed brackets now. Everything is AI generated, doctor driven, so it has decreased treatment times. It ranges anywhere from 6 months to 2.5 years. A lot of adults, they don't always want the 2.5-year perfect treatment plan. They're looking just to straighten their top teeth. So we try to meet them where they are and provide different options so that we can always make sure that they're happy with the end outcome and they don't have to sign up for a 2-year plan if they don't want to.
Right.
Yeah.
Now we've heard about the clear aligners. Yeah. Do those work as well as the metal braces?
They absolutely do.
Okay.
As you can imagine, based on how severe the occlusion is, not everyone is a candidate for that, but a lot of people are. The other issue is compliance. So, braces are on 24 hours a day, so they're working all the time. You're trying to mirror that with the aligners. So if you're not wearing them or you don't think your child would wear them, that's probably not a great option, but the end outcome is usually the same.
Okay, that's good to know.
Yes.
Yeah.
Well, braces that I know they've come a long way. We just talked about the length of time. What about pain levels? Has the pain gotten lesser and lesser over the years with the newer technology?
I think so. So modern orthodontics, we use nickel titanium wires. It's very gentle, gradual pressure over time. The aligners, we program 0.25 millimeters, a tiny little bit of tooth movement per tooth, per tray. So it's very gradual, consistent pressure. With that being said, teeth move in response to pressure, so there is pressure, but it's very gradual and controlled, and people tolerate it very well.
Yeah. When I had them, I would just take like a couple of ibuprofen, no big deal.
Yes.
Okay, good. And another myth that people have about braces is, should they wait until all of their child's permanent teeth are in, or can they do it earlier?
So the American Association of Orthodontists recommends all children seek evaluation at age 7. And the reason, I have a 6-year-old, so teeth are falling out and growing in at rapid rate right now. So it's easy for us to just quickly take a look, take an x-ray, make sure all the teeth are present, that there are no oral habits like thumb sucking going on that could hurt growth and development, and just make sure there's not cross bites. We can catch big problems early at that age, so it's important just to have a quick checkup. Usually we're monitoring yearly until all the teeth come in. We have a kids club, we put them in, it's fun, it's an easy appointment, but it's important for us to check early so that hopefully if we do need to intervene, we can start then and help a big problem become smaller.
So that would shorten the treatment time then. Yeah, that's awesome.
Well, if somebody, especially an adult, is on the fence about whether or not they want to do this, what advice would you give them?
Come see us. So I just finished treatment, my sweet 72-year-old neighbor yesterday, and she stopped me one day and was like, hey, am I too old to have orthodontic treatment? I'm like, why don't we just have a consult? We offer free consultations, and it's worth just looking into. It can greatly improve your oral health by being able to clean better and also your self-confidence. So I think it's worth scheduling an appointment.
That's great advice.
And you guys are great to work with.
Yes.
So we're going to have all of the information for Greer and Maggard Orthodontics up on the screen. It's never too late. Check them out today.